All right, so next technique we're going to go over is oftentimes used when someone has a known meniscus tear in the knee, but also can be used as a general technique, but this is from an FMT approach standpoint. They'll teach this as a technique to try and help a meniscus tear that maybe has a little flap that's in the joint space, to get that flap to be able to lay back flat so that the knee's happier to move without there being this like compression into that flap of a tear of the meniscus. Okay, so the way that we do this, and the first one that we're going to do here is the medial side. So for the medial side, what you do is you start in a flexed position. You have the foam roll. For some people, it needs to be closer to the knee. For other people, it can be further away from the knee. It depends on how much mobility there is or laxity there is here in the varus direction. If there's a lot of laxity, you have to come a lot closer to the knee with the foam roll. If there's not, then you can be further down the leg. Okay, I think further down the leg gives you a little bit more control, but sometimes you just have to be a bit closer here. Okay, so we start in a flexed position. I try to get her leg in as neutral of a position as I can. And in this flexed position, probably thinking about like, I don't know, between 20 and 30 degrees of knee flexion, I will sink straight down, take up the slack straight down towards the table, and then I actually compress my hands together. Okay, so essentially what we're doing is approximating the medial surface of the joint, and I'm just going to kind of maintain that and feel what happens as she straightens her knee back towards me, and it kind of comes up like this, and that would be considered a positive speed bump test, where the knee should be able to stay on axis, stay in this plane, and move straight back. And as you can see, it kind of raises up there, and that's what we want to try and get rid of with this technique. So I am compressing down towards the table, or shearing down towards the table, compressing the joint together, and then I want you to straighten that knee, and I'm blocking now. My intention in, hold right there, and slowly let me move you. Is that painful at all? If it's painful, you don't do it on this technique specifically. And straighten out, hold, and slowly let it bend. That's not true for all functional mobilizations. Sometimes it's going to be painful and straighten out. But if someone does have a known meniscus tear and you're working through pain and just compressing the mess out of that tear, they're going to not like you, and they're going to not come back. And slowly bend that and straighten it out. Okay, and I'm not going to treat it out right now, but I would continue working on that until I can get her leg all the way straight without it wanting to come up into my hands. I can then go back and do the same assessment again and see if it's able to stay on axis better. If it is, I'm super encouraged, because I think that meniscus is going to maybe be less of a problem for that patient. If there is no meniscus tear and they have a positive speed bump test and you smooth it out, great, because hopefully that's going to help with some of the congruency or joint dynamics of that knee with function. Okay, so that is medial congruency of the knee.